Welcome to Deuk Spine Institute. Today is September 16, 2025. Our patient presents to us with neck pain he's had for 10 years. We can now cure neck pain. We just need to figure out what is causing each person's neck pain. There are 30 identifiable sources of neck pain that cause 99.9% of chronic neck pain. And we have identified those sources at Deuk Spine Institute. Now we are diagnosing people with their cause. Once we know the cause, we have a treatment for 99% of chronic neck pain we can cure. Henry, let's show the audience the most common causes of neck pain.
I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-C7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain.
You can see for the 30 different causes of neck pain include disc injuries, facet joint injuries, and they account for about 98% of chronic neck pain. Fractures of bones, very uncommon. Tumors, uncommon. Infections, uncommon. But fractures, tumors, infections account for less than 2% of chronic neck pain. The real cause of chronic neck pain is either a disc injury or facet injury. That is really the main causes. In this patient, he has both disc and facet injuries. All right, I'm going to count 2, 3, 4, 5, 6, 7. You guys are sure we're doing 6, 7? Let's take a look at that MRI. If you have questions, feel free to ask me. 2, 3, 4, 5, 6, 7. You agree, Jordan?
Yes, sir.
And it's 3, 4, and 6, 7. So we're placing 2 separate needles. The first one will be at 6, 7. All right, everybody ready to do their job? How much, it feels pretty supple. How much time should I give it? All right, if you have questions, ask. Otherwise, we're going to be talking and working here. We need to place 2 needles percutaneously into the spine. This is minimally invasive endoscopic cervical spine surgery. Shot. 2, 3, 4, 5, 6, 7. Perfect. Shot. 2, 3, 4, 5, 6, 7. Looks good. And shot. Yes, that's perfect. Give me an AP. Quick. Quick now. Lateral. All right. Shot. Yeah. Shot. AP. Shot. Perfect, perfect, right in the middle. I love it. You can see Staples higher up. That's where we did his Deuk plasma rhizotomy earlier today. All right, so we are at 6-7. Everyone agree? 2, 3, 4, 5, 6, 7. Yes? Yes. I need to angle up. Shot. Perfect. So we're in the disc. We've gone through the anterior annulus with the needle. I'm going to go in a little further. And I'm going to do a discogram in just a moment. Shot. All right, but for now, shot. I'm going to leave this needle where it is. Okay? So, I place one needle at 6-7 because we're fixing 6-7. The next needle is going to go to 3-4. Just going to give my hands a moment to rest. His face is here looking up at the camera. His chest is here. We're on the left side of the neck. This surgery is basically bloodless surgery, and there's no hospitalization needed. It's all done with minimally invasive endoscopic technique. All right, shot. Let's check that needle, make sure it doesn't move. Good. That's rotated here. I can't have the head rotating like that. Come on. Shot. All right, 2, 3, 4. We're doing 3, 4. Everyone agree? No, I need to get up higher. Is that muscle relaxer still on board? Shot. You can do a little flexion. Yep. Shot. Shot. AP. Quick. Shot. Lateral. No, this needle is not working. It's the stylet is moving. Shot. AP, quickly. Jordan, I know it's lateral. I know it may seem difficult, but try to do two planes at the same time. Does that make sense? Shot. Shot. All right. Shot. 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 Coker, AP. There you go. See? You can do two planes at the same time. Perfect. Lateral. Boy, that 6-7 needle is really bending, huh? Look at that. That's amazing. Wow. Okay, well, it is what it is. Shot. Uh-huh. I would like to try to do, yeah, shot. That's amazing, huh? So I'm going to do the discogram at 3-4. I'm going to put a K wire. I'm going to put a guide wire in 3-4. I think I'm going to maybe even, well, I'll leave the needle, I guess. Henry, let's show the audience how discs can be so painful. Look at that tear right there. Shot. Shot. Bulge right there.
Yes, we do.
Tear. That's 3-4. Yeah. Well.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. What do we show the audience?
What causes a cervical
Shit.
herniated disc?
Great. Thanks. Thanks for doing that.
Of course.
Shot. Shot. Wait. Shot. Did you show the audience how we fix a herniated
Not
disc?
yet. Most certainly can.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, let's show our audience a patient who had this procedure done, one of our testimonials,
Of
so they
course.
can understand the benefits of the procedure.
And good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Deuk Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
Infusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen. The risks, it was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Deuk laser disc repair repair and the Deuk plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.
Welcome back. So the entire surgery is done endoscopically, transdiscal, through a tube that is 4 millimeters wide. The tube goes over the dilator, which is already in the disc space. We're going to advance the tip of this tube all the way to the end, right where it meets the herniation at the back of the disc. You can see the herniation on the x-ray. We just need to watch the dilator, make sure the dilator doesn't go backward or forward. It's coming backward a little bit, so I got to advance it again. Shut. The dilator tip is literally sitting in the herniation. So if I could get this tube in the herniation, then I'm going to be able to remove the herniation from inside itself, which is really an amazing way to do it. It's the best way to do it. Being able to take a herniation out from inside itself is pretty incredible. Every surgeon would love to do that. No, the other one's fine. Any questions from our audience?
Yes, we have a lot of questions and comments on our chat. This first one is coming from Adam on YouTube, commenting, really wish insurance would cover the laser procedure.
Me too, my friend. Insurance does cover it, but not all insurances. That's the problem. It's inconsistent. It's all about contracting. Insurances contract with who they want to contract with. Doctors, hospitals, nursing homes. And what insurances do, unfortunately, is they don't use quality of care, quality of outcomes to decide who they should contract with. What they do is they see what's the cheapest for us. What's going to cost us the least? So nobody knows about this dark world of health insurance contracting. But basically, if you're not contracted with the insurance company, which they choose who they want to contract with and who they don't. Basically, we don't have a choice. They will come to us. It may cost us $25,000 in cost to do this surgery right here. Let's just say 25 grand. We'll go to the insurance company and we'll say, we want to contract with you for $30,000. And they'll say, well, no, we'll contract with you for $3,000. Well, the problem is if we contract for $3,000, we're losing money on every single surgery. We'll go out of business very quickly. But the insurance company doesn't care. They're not here to provide care for you. They're here to make you believe that they're providing you care. But in reality, they would be very happy if every doctor in every hospital went out of business and they took money from you every month and you couldn't find a single doctor or hospital to go to. And that way you're not spending their money. That's what they want. That is the perfect world for an insurance company, okay? Is to have zero claims and all they have is revenue. They get your money every month and they pay nothing out. So To get as close to that as possible, they would need to control the spend, how much money they spend on your health care. So to do that, they would have to be able to deny treatments whenever they want to. And that's exactly what they're doing. To control their spend on health care, they are able to deny whatever treatments they want, and they just say that it's not medically necessary. We determine what's medically necessary and what's not medically necessary. That's what they say in their contract with you, the patient. And we determine what's medically necessary and not medically necessary, and we determine what we'll pay for. Now, you can go out and have whatever surgery you want done, but we're just not going to pay for it. That's what they say. So we're not practicing medicine. We're just telling you what we'll pay for and what we won't pay for. So that's one way, is through the denial process. They call it a denial, where they deny to pay for something, okay? The second way they do it is through contracting. They just won't contract with whoever will not take a loss, basically. They keep in network the hospitals that want to be in network. For example, United Healthcare Group now owns 10% of all the physicians in the United States. United Healthcare Insurance now contracts and employs 10% of every doctor in America. So if you're working for United Healthcare and you tell your patient you need surgery, United Healthcare is going to pull you in the office and their executives are going to say, don't recommend surgery anymore, or you're going to find a job somewhere else. And that's exactly what happens. And they have gag laws where you are gagged as a physician. You're not allowed to tell the patients about these contracts. They're called gag laws. So the insurance companies gag doctors and hospitals from disclosing what they do. And they just don't want people knowing about it because they know there'll be public outcry. So you guys think the insurance companies are wonderful, they love us, State Farm, like a good neighbor, State Farm will be there. You just eat into all their bullshit and lies. In reality, they're the most evil, malicious, sadistic pieces of garbage in the world. And all they're doing is denying treatment all around the world every single day. The Wall Street Journal wrote an article earlier this year in February 12th, 850 million denials by the health insurance company every year for doctor-recommended treatments. So it's not, Dr. Deuk, we wish your laser surgery was covered. Well, we do about 300 a year, so that's 300 denials a year. What about the other 850 million denials a year that have nothing to do with laser surgery? See, the big problem is not lack of coverage for Deuk laser disc repair. The big problem is that you guys are being treated like a bunch of rats, and you don't know that. You guys are just paying your insurance premiums every month, oblivious to the fact that your insurance companies are denying and your treatment, denying what the doctors want to do to help you, and they're basically only allowing doctors to do cheap things that don't cost them money. That's really what's happening, and it's getting worse every year. And it's going to keep getting worse until you guys pull your heads out of your assholes and you look around and see what's really happening. This is not a wish Deuk's spine was covered. This is a all of the things that are covered today will not be covered in a few years from now. They're going to have excuses not to cover any of them because they're getting away with it and you're doing nothing about it but complaining here. What you have to do is go out and do something about it. You need to talk to your politicians. You need to hold them accountable. You need to make sure that they are going to not let the insurance companies deny treatments that the doctors are ordering. And if they want to deny the treatment, then there needs to be a committee that has nothing to do with the insurance company. It's public people that are looking after your best interest. And that committee decides if the treatment should be paid for or not the insurance company. And if the insurance company is denying treatments that the committee says they should be paying for, and the insurance company is saying your treatment is experimental when it's not really experimental, they were just lying, they need to be held accountable with billions of dollars in fines. That's how you fix the system. Punishing the bad people. They must be punished. Otherwise, bad people do bad things. The insurance companies are bad. They're very, very, very bad. They've spent the last 80 years writing the laws silently, quietly, while you guys have been getting great insurance. And America was #1 in the world in healthcare. And while they were paying for all those procedures that made us #1, they were paying politicians to write laws and pass laws that basically allow them in the future to deny treatments for you, the American people. And that's what they've been doing behind your back, sneakily, quietly, sadistically, basically writing laws that let them deny whatever they want to deny paying for. And so now they have full control over healthcare. They can put a doctor in network they want, kick a doctor out when they don't want the doctor. You have no say over it. You think you do, but you don't. And what they're going to do is they're going to replace all the doctors with nurses and other providers that don't do surgery and don't make recommendations for expensive treatments. And they're going to get rid of the doctors. That's what they're doing, okay? Notice how you go to the doctor's office, you can't even get a hold of them anymore, and you're seen by a nurse or a PA, not the doctor. Why do you think all these changes are happening? You really think they're good changes? They're not good changes. They're bad changes. But we're letting them happen. Why? Well, great question. Why? I think because most people don't know. All right, you can see herniation right there. We got a tear in the PLL. I'm going through the PLL. This laser is the most advanced tool in surgery. I'm able to remove literally 1/20th. There's a herniation right there up against the spinal cord. I just took it out right there. You guys see that? Here it comes.
Yes, we do.
Now that was literally pressing against the spinal cord. You can see the spinal cord down there, right past this opening in the PLL. That, folks, is the spinal cord right there. Okay, so I'm actually got the herniation out that was sitting on top of the spinal cord. I'm floating it out of the tube. I've already taken out about 10 pieces of herniation. But yeah, this is the best spine surgery in the world for a herniated disc. But the insurance companies do not all pay for it, and they don't want to because they know this is the best surgery, and they know that there'll be a run on it. You know, that people will all want to have this done if they approve it. So we're fighting them to try to get them to cover it in court. We want to force them to cover this treatment. But that's costing me personally millions of dollars that I'm paying for, and I haven't gotten paid that money back by anybody. We have no support from anyone out there, none, zippo, zilch. We have no money from Bill Gates, Elon Musk, no foundation, nothing. Every single thing we've done has been from money from our patients or insurance payments. We have zero support. We have a lot of people who say, oh, I wish, but nobody helping. So if you want to see change, you got to do something about it. Don't just complain about it. Put your money where your mouth is and do something about it. Come out here to Deuk Spine, see what you can do to get involved. But I can tell you right now, the only way you're going to get the laws to change is to force the politicians to change the laws. They're called lawmakers for a reason. All right, just about done with this disc. For those of you who say, oh, Dr. Deuk sounds like he's angry. Yeah, I am angry. I'm angry because I've been saying the same thing to you all. Maybe not this exact group of people, but I've been talking about this problem for 20 years. And yet very little is done about it. And so you guys just want to complain, but you don't want to do anything to fix the system. By the way, it's going to take more than a Dr. Deuk Majan to fix the system. I cannot fix the system. I'm one man. That's it. We need literally millions of people to do something about this. They got to go march on Washington. You guys are all distracted by things that are less important than your own health. Your health is the most important thing in your life. And you guys are being basically corralled like cattle into having fusion surgeries and artificial disc surgeries and laminectomies and pain management procedures that frankly make you worse. And why do the insurance companies cover those? Because they know that they don't work. and that word will get out, and that most people will limit themselves and not get those treatments. They don't have to say no. You're going to say no. Anyway, I know we got more questions, so I'm going to take the questions, but we're almost done here. And this is number 3-4, correct? Huh?
Yes.
Yeah. So this is the 3-4 disc, for those of you wondering. He had 2 herniations, 3-4, 6-7. We're doing 2 discs, and they are not next to each other. We don't get a lot of patients like these. Most of the patients that we do 2 discs or more on the cervical spine, those discs are next to each other, like 5-6-6-7, 4-5-5-6. But in his case, he's a bit of an anomaly. He's got a 3-4-6-7. So there's 2 normal discs that are, oh, look at that. Do you see that piece of herniation come out of the foramen?
Yes, we did.
It literally was sitting on top of the nerve root, and it just, the laser got it to come out because the laser does something very special. It vibrates the water. It creates what's called a cavitation wave, which is a sonic wave inside the water, and it's very powerful indeed. All right, we'll take some more questions.
Next question from Jason on YouTube,
Jason, welcome.
asking, I have watched a few of your open back surgery videos.
Yeah.
No bloody wonder you preferred to do laser surgery.
Yeah.
I was wondering what happened to Jason and Lori.
Great question. Lori was a PA, and she moved on, took a job somewhere else. We weren't busy enough to keep her employed, so we had to let her go. She's great, though. Lori's Schellenbach. Jason, I can't really comment on Jason. I really should refrain. I'm just not going to say anything. But he's gone. Obviously, he's gone. He's been gone. But I knew Jason from my time as a resident at Shands Hospital. Jason was a scrub tech in neurosurgery. And when I went out on my own and started my own practice, after a few years, when I opened my own office-based surgery center, I started doing surgeries out of the hospital. I contacted Jason to help me. He did a great job of helping me set up and do the first Deuk laser disc repairs in our office setting with an anesthesiologist named Dr. Rappaport, Todd Rappaport, as a matter of fact. We did it in an office. And that's legal, by the way, in Florida. You're allowed to do office-based general anesthesia as long as you are compliant with all the laws and requirements, which we were. All right, we're just about done. That is the spinal cord right there. Boom. We want to protect that, stay away from it. We've gotten all the herniation out. I'm very happy. We're done at 3-4. So yeah, Jason and Lori are gone. And by the way, my open surgery technique is literally the best in the world you're ever going to see. If these other surgeons ever showed you their open surgery technique and compared to mine, you would say, wow, Dr. Deuk does an amazing open surgery, very little blood loss, very clean, very precise. And that's what I learned. I learned open surgery from the best spine surgeons in the world at my program, and I went out and perfected it. But you're right, it's far more invasive than what we're doing today. And this surgery has better results. So not only are we getting better results, but we have less trauma to the patient's body and fewer complications and faster recovery. So this is definitely an improvement. All right, one down, one more to go. So we're going to bring our fluoro back in. Hopefully the needle hasn't moved. Let's go back with a lateral view. I'll keep taking questions while we're getting ready to do number 6-7 disc with the Deuk laser disc repair.
This next question is coming from Thomas on YouTube, asking, I noticed that predominantly you have procedures to rid patients of pain when working on bulging discs.
Oh, hold on a second. I need an x-ray shot. Okay, there it is. Wow, that needle almost came out. You guys see that?
Yes, we do.
All right, shot. Uh-huh. All right, guys, 2, 3, 4, 5, 6, 7. Okay, I'm going to go ahead and move down to 6-7. I need a better view of 6-7. Let's get those shoulders down. Let's see 6-7 nicely shot. All right, that is better. Excuse me. Give me a second on the questions. I've got to focus here. Shot. All right, we have not yet done our discogram at 6-7, so I'm going to start with a discogram. That's our dye to look for the tear, which we're going to be repairing. Shot. Shot. There it is. You guys see the herniation? Jordan,
do.
show the audience the herniation. It's the black is the dye above the herniation. The herniation is the white stuff. It's the white bump. Now again, his herniations are not gigantic, but they are significant. Give me 1 sec, Henry, and I'll take questions. I just got to get through this.
Copy
This
that.
is the hardest part. So let me get through this. You can see the other incision is perfect, not even bleeding. I think we've lost like 5 drops of blood. Knife. What's going on, Dr. Berndes? I don't, huh? All right, but I don't want the neck moving while I'm operating here. Do you want me to stop? No, it's fine. I can stop if I need to. All right, put a little pressure above. Okay, you can see this is bloodless surgery. We're not bleeding. If you do an ACDF or artificial disc, there's going to be gobs of blood coming out everywhere, except for mine. All right, Jordan, you got to come further south. You are not showing me the disc. I need to see the disc. Guys, do you know why it's so difficult to see? Because there's contrast dye in these rags here, and that's why it's obscuring the view. Come on. Shot. All right, that's better. Shot. All right. Let's get this guide wire in. Shot. Sorry, folks. I need to focus here for now. Shot. All right. Shot. There it is. I'm going to take the needle out. Shot. I'm going to keep the guide wire in place. Shot. I'll be right back with you in a moment. There it is. Very difficult surgery, by the way, to do 2 discs or more in the neck with the endoscopic approach, because you have to either place 2 needles and one of them can be bent or move out while you're messing around with the other one. The other reason is if you move along the spine to go from one to the other AP, then you can move out of position and accidentally damage something. There's a lot of things that can be damaged. If you guys go online and look up endoscopic spine surgery, you'll notice I've been doing this for 20 years, endoscopic spine surgery, true endoscopic spine surgery, the surgeries you watch me do, okay? Other surgeons are just starting to do it. A few have been doing it for about 5 years. I've been doing it for 20 years. You'll notice they're all lower back because the lower back is a much safer, easier surgery to do endoscopically. The neck is very, very difficult surgery to do. But we do it. We've been doing it for 20 years. The other surgeons won't even touch it because it's so complex. But endoscopic transdiscal surgery is in the cervical spine is the hardest to do. So it takes a tremendous amount of skill and the right equipment, the right staff. Everything has to be perfect to get it right. The cost of failure is too high in the neck, too high. In the lower back, there's almost nothing you can hurt. I mean, it's, okay, of course there's things you can hurt, but nothing compared to the neck. The cervical spine has 10 times more significant things that can be damaged during the surgery, which is why it's much harder, it takes more skill, more experience, and that's why you don't see anybody else doing it but me. Same thing in the thoracic. I'm the only one who does thoracic endoscopic surgery. Not what they're calling endoscopic nonsense going through the chest cavity, but actually transforaminal endoscopic. Look at that, the dilator moved back. See that? That's because of the pressure inside the disc is pushing it out. Jordan, I need more pictures. Please don't be stingy with the x-ray machine. We don't get points for not taking x-rays. All right. Shot. I'll get to your questions momentarily. I've just got to get everything in. It's a very difficult part of the surgery. Henry, if you want to show them another video, go for it.
Copy.
Have you already shown them the Deuk laser disc repair, how it's done?
Yes, we have.
So you did the how disc cause pain, and you did, Jordan, come on. Is that it? Jeez, this thing is not wanting to go in. All right, there we go. shot. Henry, if you want to show them something.
Copy that. Playing.
And good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute. I'm here with my patient who traveled to Deuk Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that it is really nice procedure, and the staff here is really nice. Always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have
We are
is not
currently
going in
working on
earlier
number
and living
6-7. It
18,
is the
20
last
years with
disc we're
pain.
fixing. And there is tons of scar tissue here at the back of the disc where the herniation is. So I'm removing with the laser scar tissue, inflammatory tissue, herniated nucleus, calcifications or calcium deposits, all of which cause symptoms. Let's take some questions from our audience.
This question is coming from Thomas on YouTube,
Hi, Thomas.
asking, I noticed that predominantly you have procedures to rid patients of pain.
Yes.
When working on bulging discs, are you able to communicate with the patient in the same manner to locate weakness?
I'm not sure what you're talking about. As far as weakness, what I do is I figure out where the weakness is coming from before surgery, not during surgery. So we do our exam of the patient in pre-op. We look for weakness of muscle groups, or called myotomes. And based on that weakness profile that we're seeing pre-operatively, we know which herniated discs are causing those symptoms. For example, if the bicep is weak, then it's probably C5-6 that's causing those symptoms. We didn't push down, right? No. Don't push down. Just stabilize. Why does the irrigation look so bad? Any reason? I don't know, but I'll see. Yeah, looks better. All right. And next question.
Next question coming from Carolina Dude on YouTube,
Hello, Carolina Dude.
asking, hello, Dr. Deuk, can cervical disc injury cause IBS?
IPS or IBS?
IBS with a B.
Is that inflammatory bowel syndrome?
I believe so.
No, never. Nope. Cervical disc injury will never cause an inflammatory bowel syndrome. Nope. Next question.
Next question is coming from Jason once more on YouTube, asking, do you still do open surgery now? I bet you and your staff are thankful you're not standing and concentrating for up to 5 hours.
Yeah, you're right, Jason. I will do it if I have to. For example, I do have a patient I'm seeing in clinic right now. We just diagnosed him with C1-C2 instability. He has arthritis in the C1-2 joint, and we are going to recommend fusion of C1 and C2 for him. I don't know if he's going to take it, but he's having massive amounts of pain at the base of his skull, right where C1-C2 is. So that's the only thing we can offer him, is the C1-C2 fusion.
Next question from Jason once more on YouTube, asking, is there a large difference in cost to the insurance companies between open surgery with all those plates and screws and laser surgery?
Yes. Yes, laser surgery that we do is roughly 2/3 of the cost of invasive spine surgery for the actual surgery itself. But what you have to understand is people who get invasive surgery, they end up in pain management the rest of their life. They're getting shots, they're getting therapy, they're getting all kinds of treatments, additional surgery for adjacent segment disease. They get all kinds of treatments literally for the rest of their life. So the cost, move your head please, long term for invasive surgery is much higher than it is for laser surgery. Laser surgery is a one-time cost with a cure and then go back to a normal life. Invasive surgery is a very high cost and then more treatment, more treatment, more treatment for the next 20, 30, 40 years. So the cost never ends. The insurance companies look at it as, well, we don't care about the cost 20 years from now, 10 years from now, because this person may change their insurance plan and they're going to go with another insurance company in 5 years. Or they're going to leave us, they're going to stop working because they can't take the pain anymore. They're going to quit work or they're going to get fired, and then we don't have to worry about them. That's how they see it. All right, we're just about done. This patient's chest is really getting in the way. I cannot get any more of this 6-7 herniation. I've done what I can. I would like to do more, but I just cannot. Because unfortunately he's barrel chested, he has a big chest, and I cannot get far enough down to get more of this herniation. The chest is blocking me. So we've done what we can. I'll do another minute or two. Let's take a few more questions and then we will call it quits. We'll bring our next patient back, who is a single level cervical DLDR.
This next question, we have 2 more questions. Next one from Dante on YouTube, asking, I understand how you fix the joint pain. I have been told I have a vacuum disc at my L1, L2 area. How does that decompress the nerve so that my right leg stops going numb every time I put weight on my right side? My perception of you burning the nerve doesn't seem to do anything for nerve compression.
Yeah, that's correct. The burning of the pain nerve is not the right treatment for your problem. I would never recommend that for a compressed nerve. What you need is the Deuk laser disc repair, which is what we're doing here, where we go in and use a laser to remove the herniation, pressing on the nerve. So wrong treatment. We wouldn't do the Deuk plasma rhizotomy for you. We do the Deuk laser disc repair.
And then lastly, coming from Lanu on YouTube,
Hi, Lanu.
asking, is there a connection between a herniated disc and Parkinson's disease?
No, there's no connection between herniated disc and Parkinson's. Unless you're Parkinson's and you fall and get a herniated disc. Okay, you can see the incision is 4 millimeters right there.
Yes, we
We
can.
have 2 of them, 1, 2, because we had 2 discs to fix. So we're done. We'll be back shortly with another patient with a cervical disc herniation. And I got this while you do your stuff. Any more questions?
No current questions.
All right, let's end with one of our patients who's had treatment at Deuk Spine.
Of course.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much, you know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later, feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.